And today's anatomy lab is on ureter, urinary bladder and the urethra. Okay. I think you people are familiar with this, isn't it? Just now you finished seminar regarding this, isn't it? So, what are these ureters? These are the pair of narrow, muscular, thick-walled tubes, isn't it? Muscular, thick-walled tubes which conveys urine from kidney to the urinary bladder. Okay. About the length of the ureters, that is 25 centimeter, and diameter is 3 millimeter, isn't it? So here, both the kidney, ureter and the urinary bladder. Total length, how much it is? 25 centimeters, isn't it? Yes. In this model, here, both kidney, okay, and ureters, okay, on either side of this aorta, okay, right and left ureter, okay. Next is about the course of the ureter. It begins from the renal pelvis, isn't it? Begins from the renal pelvis and it opens into the urinary bladder. So it is divided into the abdominal part, renal pelvis, abdominal part and the pelvic part. Okay. So here renal pelvis, okay, renal pelvis, abdominal part and the pelvic part.
Where is the abdominal part?
Abdominal floor here. From the renal pelvis to up to here, common iliac vessels. Okay. From here, the pelvic part. Okay. Pelvic part and the abdominal part. Okay.
What is the abdominal?
Abdominal. This.
From where?
Above this.
Just in the
In the abdominal cavity. Ureter which present in the abdominal cavity. Okay. Yeah. Abdominal part and the pelvic part. And next is about the renal pelvis. The minor calyx join to form a major calyx, isn't it?
Yes.
So major calyx join to form a renal pelvis, isn't it?
Yes.
So renal pelvis continues as a ureter. Okay. Next is about the relations of the abdominal part of the ureter. Okay. So the posterior relations, these are the psoas major, genitofemoral nerve and the tips of the transverse process of the lumbar vertebra. Okay. So here the on either side these are the ureters.
Yes.
Isn't it? Left and right ureter. So behind this posterior relation, so this is a psoas major muscle, tips of a lumbar vertebra.
Both sides.
Transverse tip of transverse process of the or lumbar vertebra. Okay. So here it is the psoas major muscle, isn't it? Posterior relation, posterior to the ureter. Okay, and tips of the transverse process of the lumbar vertebra. Okay, you know
Yes.
tips of transverse process. Okay, and genitofemoral nerve. See here, yellow colored. Okay, so here it is the genitofemoral nerve. Okay, keep it in mind. First one is bigger one, that is psoas major. Okay, and genitofemoral nerve, tips of the transverse process of the lumbar vertebra. These are the posterior relations of abdominal part of the ureter. Okay, is it clear?
Yes.
Next is the anterior relation. In the right side, it is covered by the peritoneum. So here it is the abdominal cavity. It is covered by the peritoneum. Okay, covering. So it is covered by the parietal peritoneum. Okay, and right gonadal vessels. Okay, and right colic and ileocolic branches from the superior mesenteric artery. Okay, and the route of mesentery and the coils of the small intestine. Coils of the small intestine. These are the anterior relations of the ureter, abdominal part. Okay. See here, superior mesenteric artery. Okay, these are the branches and the gonadal vessels anterior to the ureter here. Okay, same thing in this gonadal vessels. Okay, anterior to the ureter on either side. Okay, so these are the anterior relations of the abdominal part of the ureter. And in the left side, covered by the parietal peritoneum. Okay, same. Okay, and next is left gonadal vessels. Okay, see here, left gonadal vessels and left colic and sigmoidal branches of the inferior mesenteric artery and sigmoid mesocolon. Okay, and the sigmoid colon. These are the anterior relations of both left and right ureter. Okay, right side and left side. So, if I put a X mark here, write the anterior relations of X mark. So that is left ureter. It is different from right side, isn't it?
Yeah.
So the sigmoid mesocolon, sigmoid colon, okay, and sigmoidal branches of the inferior mesenteric artery, whereas superior mesenteric artery. There is a difference between the right and left ureter. Okay. This is about the anterior relations of both ureters. Okay. Next is pelvic part of the ureter. Again, it is divided into three parts: first part, second part, and the third part. That is vertical part, oblique part, and the intravesical part. So here it is the vertical part till arched line. Okay, and here it is slightly curved here. Okay, and this is oblique part, and the intravesical part. Intravesical means inside the bladder. Vesicle means bladder. Intravesical inside the bladder. Okay. So three parts in the pelvic part of the ureter.
What is the oblique part?
Oblique part. Okay. And vertical part.
So here connection.
Here it is not there. It is cut part. From here it is cut. So the vertical part starts here. Okay, vertical part, again oblique part and intravesical, that is within the urinary bladder. Okay, three parts. Next is relations of the vertical part. Here it is the ureter. It opens in the urinary bladder here. Okay, and it is the pubic symphysis. Okay, rectum. Okay, and the vagina. So this is a female cut section. Okay. So here it is the vertical part. So anterior to this, here it is a ovarian fossa in case of female, not in case of male, isn't it? And the inferior vesical artery, broad ligament of the uterus. These are the anterior relations of vertical part of the ureter. And about the posterior relation, internal iliac vessels. Okay, vertical part of the ureter. This is about the relations of the vertical part. Okay. The next is relations of the oblique part in case of female. See here. Here it is the oblique part of the ureter. Okay. On either side of the cervix. On either side of the cervix from 1.2 centimeter from the cervix. Okay. Here it is the broad ligament of the uterus and the cervix. On either side the oblique part of the ureter. Okay. 1.2 centimeter from the cervix. Okay. See here, it is retracted part of the urinary bladder. Here is the rectum. Okay. And ureter. Here is the cervix. Okay. From cervix 1.2 centimeter. From the cervix here is the ureter within the broad ligament of the uterus. Okay. Next is in case of male, on either side. So here is a inguinal ligament, isn't it? So the ductus difference on either side. Okay, it encircles the ureter. Okay, it encircles the ureter on both the sides, and here is the seminal vesicle, urinary bladder. Okay, and opens into the prostatic part of the urethra. Okay, ductus difference in case of male. Next is about the constrictions of the ureter. 3 constrictions in the ureter. Okay, that is pelvic-ureteric junction and the pelvic brim and point of entry into the urinary bladder wall. Okay, these are the 3 sides of constrictions of the ureter. See here, where the renal pelvis continues as a ureter. So you will find a small constriction. Lumen is narrowed there, isn't it? So in the previous slide, you can see here, renal pelvis continues as a ureter. Here, the wall is narrowed here. Okay, constriction. Next is in the pelvic rim, passing from the common iliac. Okay, where you will find the constricted part of the ureter. Okay, and here it is the point of entry to the urinary bladder. Here also you will find a constriction part of the ureter. Okay, why these sides are important? Yes, these are the common points or common locations for the renal calculus, renal stone. Where the lumen is narrowed, it will stuck into that. Okay, calculus stone. That is why it is clinically important to know the constriction in the ureter. Okay, this is about the constriction. Next is about the blood supply. It is by the branches from the renal artery, gonadal artery, lumbar artery, okay, and peritoneal artery and the internal iliac artery. Branches from the internal iliac artery. Okay, these are the branches from renal artery, gonadal artery, lumbar, peritoneal and the internal iliac artery. Okay, this is about the blood supply of the ureter. Okay, and nerve supply, the parasympathetic, it is by from D10 to L1, and parasympathetic it is by S2 to S4. Okay, this is about the nerve innervation. Next is about the applied aspect, bifid renal pelvis. Okay, so here bifid renal pelvis here, and duplication of the ureter. The ureters are in 2 number. Okay, duplication of the ureter and the ureteric calculus, stones in the ureter. This is about the ureter. Next is urinary bladder. About the shape of the urinary bladder, when it is empty, okay, that is tetrahedral in shape, and when it is full or distended, it is ovoid in shape. Okay, so ovoid in shape when it is full, and when it is emptied, it is tetrahedral in shape. Okay, and next is parts of this capacity. The anatomical capacity, it is about 1 liter or more, anatomical capacity of the urinary bladder. Next is average capacity, it is about 120 to 320 ml. And next is sense of filling, that is from 100 to 150 ml. You will feel the sense of filling. And next is desire for mixturation, that is about 150 to 250 ml. If it is full about 150 to 250 ml, you will desire to have a mixturation, isn't it? And next, the painful sensation you will got by filling 450 ml and above. Okay.
Average capacity.
1 liter. Yes.
Average capacity.
Yes.
It's here milli. Average capacity.
anatomical capacity one.
Anatomical capacity.
Yes, it was average.
It can expand,
Yes.
isn't it?
Yes.
Up to 1 liter. Yes.
average capacity شوي
جدا إذا كان أقل حاجة.
So for every author, it is a difference of 100 ml, 200 ml. It will like that. So in some authors they have written 700 to 800 ml like that. Okay. So that is why we told about the anatomical capacity. Up to 1 liter, it will expand.
Yes.
1 liter or more. It is having a capacity to expand. It won't burst, isn't it?
Yes.
That is the anatomical capacity. Next is about the parts of the urinary bladder, apex and the base. Okay, and 3 surfaces. Here it is the apex and the base. So it is having 3 surfaces. Superior surface. Okay, superior surface. What is your role? Superior surface. Okay, and inferolateral on either side. Okay, 2 inferolateral surface. And next is about the, it is having 4 borders, anterior border. Okay, so here is the anterior border and the posterior border and the 2 lateral border on either side. Okay, anterior border, lateral border, posterior border, apex and the base. Okay, here it is the neck. Here urethra begins here. Okay, neck of the urinary bladder. And next is about the relations. So apex gives attachment to the medial umbilical ligament. So here is the apex of the urinary bladder. It gives attachment to the medial umbilical ligament. Where it attaches? Umbilicus. Okay, it is attached to the umbilicus. And
sometimes there's anatomical abnormality.
yes, here I will show you. Patent urachus. Okay, so it is the remnant part of the allantois, embryological. So it is a remnant part of the allantois where before it is having a canal. Okay, lumen. Okay, afterwards it is closed, that canal, isn't it? So that forms a medial umbilical ligament. If it is patent, remains the lumen. See here, it is completely patent urachus. Okay, where it opens at the umbilical region. Okay, and it is incomplete in these two, incomplete patent urachus here. Okay, and in the urachus you may find the cyst here. Okay, this is the 4th picture. Yeah, cyst. So here is the bladder.
Yes.
Okay, and medial umbilical ligament.
Yes.
Okay, so here you can see the, you can find the, it is an abnormality. Okay, cyst. Okay, this is about the apex. Next is base. So in female it is related with the seminal vesicle.
Female.
In case of male.
Yes.
Oh, in case of male, it is related with the seminal vesicle, vas deferens. Okay, and rectovesical pouch here.
Yes.
Rectovesical pouch,
Yes.
seminal vesicle, and the vas deferens. Okay. base of the urinary bladder relation. And in case of female, it is related with the vagina and the supravaginal part of the cervix. Base I am telling. Base of the urinary bladder. And next is superior surface. In case of male, it is yes. It is related to the sigmoid colon and coils of the small intestine. So here it is the male specimen, isn't it? So superior surface, it is related with the coils of the small intestine, isn't it? Superior surface. Whereas in case of female, it is related with the anterior surface of the uterus. Superior surface. In case of female, in case of male, superior surface. So in the OSPI, if it is a female, if we put this model, so is it male or female? Somebody will ask whether we have to write male or female. So if it is a female, you write about this. No need to ask. Huh? Yeah. See here, both are there. Just see the difference. Okay. Okay. In case of female, anterior surface of the uterus, superior surface of the urinary bladder. Okay. Next is inferolateral surface of the urinary bladder. Okay. Inferolateral surface, it is related to the body of the pubis on either side of the urinary bladder. See here, it is the urinary bladder. Okay, cut section to the pelvic cavity here. Okay, pubic symphysis. Okay, and urinary bladder. So the inferolateral surface of the urinary bladder, it is related with the pubis of the pubic symphysis and fascia covering the levator ani muscle. So here it is the levator ani muscle on either side, fascia covering the levator ani. Okay. And next is space of ridge. See here, it is the urinary bladder. Okay, and it is the cut section to the male specimen. Okay, and prostate, urinary bladder. So here is the space of ridges. Okay, space of the ridges. So this is about the. Next is the neck of the urinary bladder. In case of male, bladder neck surrounded by the base of the prostate. So see here, it is the male specimen. Here it is the prostate gland, isn't it? Urinary bladder, neck, okay, and the prostate, okay, and here is the urethra.
What is the
Ejaculatory? Here I will show you. Okay, so neck, in case of male, bladder neck surrounded by the base of the prostate. Okay, in case of female, urogenital diaphragm. Okay, so in case of female, urogenital diaphragm, neck of the bladder. Next is about the interior of the urinary bladder. So inside you will find the triangular shaped area. Okay. Yes, smooth bar. So here we will call it, this one we will call it as a trigone of the bladder. Okay. It is a equilateral trigone.
Triangle.
Yeah, it is a triangle. So it is nothing but equilateral triangle on the inner aspect of the base of the urinary bladder. Inner aspect of the base of the urinary.
The opening.
Yes, yes. Here the ureteric openings are there on either side. left and right ureter open. So where the left and right ureter opens. Okay, here. So it is having apex and the base. Trigone. Again it is having, it is triangular in shape, isn't it? So it is a base and the apex. Apex where the urethra starts. Okay, it is the point where urethra starts. Apex of the trigone. And next is about the boundaries. Just now I said the apex and the base and side by the ureteric lines. Okay, so this is a trigone. Next is importance of this trigone, the most fixed part of the urinary bladder. Okay, and it is richly supplied by blood vessels and the nerve. This area, trigone. Okay, and it is developed from the mesoderm. Rest of all urinary bladder, it develops from the endoderm, and rest of the part it is developed by the endoderm. Okay. And next is about the blood supply of the urinary bladder, supplied by the superior vesical artery, inferior vesical artery, and the obturator artery, and the inferior gluteal artery, and in case of female, the branches from the uterine artery. Okay, in case of female. This is about the blood supply. Next is venous drainage. Venous drainage, it corresponds with the arterial system. Okay. And next is about the nerve supply, the sympathetic from T11 to L2, and it is the nerve of filling. Next is parasympathetic fibers from S2 to S4. So it is the nerve of empty. Okay. Parasympathetic. See here, sympathetic fibers and the parasympathetic fibers. Okay. From T11 to L2, sympathetic fiber, and the parasympathetic from S1 to S4, parasympathetic fiber. This is about the nerve supply of the urinary bladder. And sensory fibers carried mainly by the parasympathetic, okay, and partially by the sympathetic fibers. Okay, mainly by the parasympathetic sensory. Next is about the applied anatomy. So cystoscopy, the interior view you can see, okay, for the any tumors or calculus, okay, through the cystoscopy. So here it is the urethra, urinary bladder, interior you can see from the cystoscopy. Okay. And transurethral resection of a tumor. If tumor present within the bladder, we can remove by the transurethral resection by make a tumor cutting into pieces and then remove. Okay. So that procedure we call it as transurethral resection of a tumor, or the stones, vesical stones. Vesical stones means stones present within the bladder, urinary bladder. And cystocele, the herniation of the bladder, urinary bladder, we call it as a cystocele. What is cystocele? Herniation of the urinary bladder, more common in female. Okay, cystocele. And next is urinary bladder stones. See here, it is a X-ray showing the vesical stones, stones within the urinary bladder. Next is about the male urethra. Okay, urethra, male and female differs, isn't it? So the male urethra, it is common tubular passage for the elimination of the urine and the semen in case of male. In case of female, only the urination function of this urethra. Whereas in case of male, both it is a common passage for the semen and the urine. Okay. And it extends from the internal urethral orifice to the external urethral orifice. Okay, and it's about the measurement 18 to 20 centimeter in length. Okay, 18 to 20 centimeter in length, and it has a 3 parts: the prosthetic part, membranous part, and the spongy part. Okay, so here the neck of the urinary bladder. Here is the prostate gland, urogenital diaphragm. Okay, this part, it is the prosthetic part of the urethra. Okay, so in the urogenital region, this part, it is the membranous part of the urethra. Rest, it is the spongy part. Okay, 3 parts in the urethra. Next is prostatic part of the urethra. It runs vertically within the prostate gland. Okay, within the prostate gland, it runs vertically. See here, prostate gland. Okay, this part, it is the prostatic part of the urethra. It runs vertically. Okay, and on cross section, it is having a crescentic lumen and urethral crest. See here, prostatic part of the urethra. So, urethral crest, it is a mucosal fold formed by the trigonal musculature. Here, trigone of the urinary bladder. It starts from there. Okay, so it is a slight elevation will be there. Okay, and next is the colliculus seminalis, rounded elevation at the middle of the crest. Present 3 orifices here. Okay, opening of the prostatic gland on either side. Okay, and opening of the ejaculatory duct here. Opening of the ejaculatory duct here. What you ask? Okay, prostatic part of the urethra. Ejaculatory ducts opens in the prostatic part of the.
That's seen in the growth.
No.
Only that.
Yes. What are the openings we may ask in the prostatic part of the urethra? Okay. So, opening of the ejaculatory tract and the openings of the prostatic ducts here. Okay. In the prostatic part of the urethra. Next is membranous part. It runs with the slightly curved course towards the bulb of the penis. So here it is the urogenital diaphragm. This is okay, and this is prostate. So this part, it is the membranous part of the urethra. Okay, on either side of the urethra, you can see the bulbourethral glands. In the
All the detail is important. The detail is important. Just
Yes, according to objectives, I made a slide.
yes, objective.
Yeah.
According
All
to
right. Yes.
according to the speak.
In the summary, I will tell you. So, is it clear?
Yes.
So, membranous part of the urethra. So, about the relation, it is surrounded by the sphincter urethra muscle. Okay, external sphincter in the urogenital diaphragm, and on each side the bulbourethral glands are present. Okay, on each side, and at the front side there is a deep dorsal vein of the
What
penis.
is this gland?
Which gland?
Then it-
Bulbourethral gland within the urogenital diaphragm. Okay. And next is spongy part of the urethra. So prostatic part. So here it is the
Brainus.
urogenital diaphragm, only small part. Okay. Membranous. Okay. And next it is the spongy part. Rest one is spongy part of the urethra. It passes through the bulb, body, and glands penis, terminates at the external urethral orifice at the tip of the glands. At the tip of the glands, it terminates. Okay. It begins in the bulb of the penis. Here is the bulb of the penis. It starts. Okay. Bulb of the penis, and it terminates in the external orifice. So it presents two dilatations. Spongy part of the urethra, it is having two dilatations. So the one is intrabulbar fossa and terminal fossa. So here you can see slight dilatation is there. So in the terminal part. Okay. And in the bulbar part you are having slight dilatation.
Where dilatation, doctor?
Dilatation
Yes.
in the spongy part of the urethra.
Other?
At the bulb of the penis, there is a dilatation, and at the glands of the penis, so it is having a dilatation. Okay, spongy part of the urethra. See here. Here at the bulb of the penis, at the glands of the penis, dilatation. You will show the dilatation in the spongy part of the urethra. Okay. This is about spongy part of the urethra. Next is sphincters of urethra, the internal sphincter and the external sphincter. So the internal sphincter surrounds the internal urethral orifice, at the region of the neck of the bladder. Okay, and the external sphincter, it is located, it is surrounded by the membranous urethra at the urogenital diaphragm. It is located, external sphincter. Okay. This is about the sphincters of the urethra. Next is arterial supply
يا شباب
of
بالله
the
شوي الصوت.
urethra. So it is by the inferior vesical artery, middle rectal artery, and the internal pudendal artery. Arterial supply of the urethra. And veins, venous drainage, veins corresponds with the artery. And next is about the lymphatic drainage of the urethra. Please keep silence. Keep silence. And about the lymphatic drainage, the lymph from the urethra drains into the prostatic and membranous part, drains into the external and the internal iliac group of lymph nodes, and the spongy part drains into the deep inguinal group of lymph nodes. Okay. And about the nerve supply, it is by the sympathetic, parasympathetic, and somatic fibers. The somatic fibers derived from the urethral branch of the pudendal nerves. And female urethra, it extends from the neck of the urinary bladder to the external urethral orifice here, and it measures about 4 centimeter long and 6 millimeter in diameter. It has the function of only the urination, to pass the urine. Okay. This is about the female urethra. Next is about the applied anatomy of the urethra, that is cystoscopy. Just now I showed cystoscopy. This is about the lab. Okay. Summary of the today's lab. About the ureter, about the length, blood supply, and the relations, anterior relation and the posterior relation. Be thorough with this in ureter. Okay. And next is the urinary bladder. Okay. So about the urinary bladder relations, especially superior surface, okay, and the base, relations of the base of the urinary bladder. Okay, this is important. Okay, and next is about the urethra, length of the urethra, and parts of the urethra in male. Okay,
Just knee, not
Yes,
this.
yes, yes. Okay. And be thorough with the blood supply and nerve supply of the bladder and the ureter.
Yes.
And also the relations of the ureter, anterior relations, posterior relations. At least 2 relations you have to write.
Yes.
At least 2. Hmm?
Inshallah, come like
Yes.
this, but I think you see the exam another thing.
Hmm.
It's from outside the lab and from outside the lab. It's the same in the
We
I
will give
don't
the
think so.
same question, but
Okay.
we don't know.
Okay.
Huh?
What about the
There is MCQ or short say
MCQ usually won't come from the lab.
about
Only
then
for the OSPE.
just for us even short say or modify.
If you know all these contents, you can easily answer the MCQ, isn't it? Whatever I told, anterior relation, posterior relation, arterial supply and nerve supply, within this only the MCQ will come. Yes, yes, yes. Huh? If you read these slides, in this only you may get MCQ, no problem, don't worry.
والله قدر ربنا لكن جاي تريد everything but the question outside the lecture from outside the lab.
The ureter, both left and right, these are different for anterior relation, whereas posterior relation
Same.
both same. Okay, anterior relations only differs from the left and right. Yeah, right one is superior mesenteric, left one is inferior mesenteric, and the branches and sigmoid cola and mesocola. Okay. So this is about the lab. Any doubts?
Thank you.